Hello. Hi.
Hi.
Hello, everyone. So thank you for taking your time to come join us today for the first day of our webinar series titled Mental Health and Trauma-Informed Care for Service Providers. We are so thrilled to have you. My name is Dina Badawi, and I'm the Mental Health Promotion Project Coordinator here at OCASI. We've developed a 6-part webinar series, of which this is the first one, and we've partnered with Hong Kong Mental Health Association to deliver this webinar to you. And so we have the lovely Maria and Emily here as your facilitators today, and I will pass it on to them to begin their presentation and introduce themselves.
Okay, thank you so much, Dina. My name is Maria Low, and my partner is Emilie Nguyen. She's going to introduce herself later on. And it's a great pleasure for both of us to be here to share this important message with everyone. Actually, both of us are going to share 3 topics. Today, we are going to concentrate on overview on mental health. But before we proceed, just some logistics we would like to share with you, with everyone, because we have a large group. So I hope that every one of you can understand we are going to mute everyone. So if you have any question, please type into the chat box to save time. So we will look at it, and whenever we have time, we will try to answer all the questions. And also at the end of each webinar, Dina is going to email to each one of you to ask for feedback, because that's the only way we can improve our next presentation. All right, so let's begin. Today, our topic, as I say, is called Overview on Mental Health. Okay, so let's take a look at the end of the section. What is our goal? We would like to define the concept of holistic health. I'm sure that each one of us have been hearing about health, especially during this pandemic time, mental health, but what is holistic health? So let's take a look, okay, today. And also, we're going to take a look and identify what are some social factors that impact on each one of us health. When I say health, not only the mental health, physical health, and our holistic health eventually. And also, I would assume most of us working with newcomer or immigrant. And so let's take a look at and recognize how the migration process impact on individuals' health status. And then we will also take a look at some warning signs of mental health issues. But mind you, when I say mental health issues, not necessarily mental illness. So it's different. Like each one of us may be at our lifetime, we will face some issues. So we are going to identify some warning signs of mental health issues. In our next webinar, we are going to talk about and concentrate on mental illness. And at last, we are going to review the role of, for each one of us. We are the frontline worker. What is our role? Some of us may say, well, I am not the mental health worker. And so maybe I am the settlement worker. So what is my role to improve the holistic health of our clients? So we will look at all this. So I would like to face this question, and each one of us can think about it. Can I say that I'm a healthy person if I just go for an annual checkup and I have a very good physical report? Does that mean I'm healthy? So let Emily do this. Emily.
Hi everyone. So it's actually it's a question that is always in everybody's minds, right? So as my co-worker were saying, that it's that if we get the report in our hands, what does it mean? So I wanted to share with you a little bit about what is the World Health Organization say. Already in 1948, they were talking about health, okay? Health is a state of complete physical, mental, and social well-being, okay? Not because you don't have any disease or we're getting old or anything like that. I mean, that's you're healthy. So, sounds all right? what is state means, right? So for me, when I look at these definitions, the key word that I see is the state. Okay, so everybody is having different state in of whether or not it's physical, mental, or social, you know. And again, also in 1986, they also say health is the resources of everyday life. Okay, again, it's the key word is resources. And I wanted you to imagine this, like me, for instance, Emilie. If I was born have a really, like, missing a limb, okay? But I'm a teacher, and I'm also a mother, and I'm also a very good friend to Maria. Does that mean I'm healthy? Does that mean I'm physical healthy? Yeah? Well, of course I am, right? I am a teacher. I work a very meaningful professions, and I'm a mother. I have children, right? So it's the resources of everyday life. Okay, so when we look at, when we look at the definitions of health or mental health, I want you to look outside of the box. Okay. Sorry, I don't want to touch anything because I'm just saying that. So when we look at the definitions of mental health, again, in 2001, World Health Organization said that mental health is a state. Again, I can be healthy one day, and if I hear bad news on something, my mental health can go down. And then if something's happened good in my life, my mental health status is up. So mental health is a state. So it's like a spectrum, okay? And in which that individual realize his or her own ability and can cope with so-called normal stress in life, and we can talk a little bit more about that later, and can work productively, fruitfully, and able to make contributions in his or her own community, right? If that sounds okay. At any time you have any questions or like to ask, please type in the chat box so that I know to address. But when we talk about that, I wanted to bring you to the warm-up exercise, the impact of pandemics. Of course, for the past more than 6 months now, each and every one of us that have this experience. And just out of the next slide, I have a few questions for you, and you can answer this when we do a poll. Does anyone feel calm or relaxed in this situation? Anyone? Awesome. I can see the numbers going up, and I can share this with you. A few more seconds. And wow, okay, great. And I would love to hear some of the, okay. So I'm gonna end in like 3 seconds. If anyone's have not been answering, awesome. So I get about 64 is a yes and 36% is a no. So with this second one, okay, I like that. Okay, hold on. Maybe I can share the results. Okay. Anybody feel sad? Okay. Question number 2, anybody feel sad? Few more seconds. Great. I can see the number going up. Okay. All right. I'm going to end the poll now, and I'm going to share that yes, no. Okay. And I like to share that result for you to see. Now the sad one is actually it's almost 50-50. Someone would say 53% say yes and 47 say no. Very interesting. The next ones, oh, okay. Anybody feel anxious? Okay, anxious. Third questions is, do you feel anxious? Wow, okay. Very nice, very good, very good. Thank you so much. And so ends in the same few seconds. So anxious, yes, more than 70% say yes. Okay, hello, someone changed their mind. And then 69% say yes, and 31 say no. Okay. And okay, and just a few emotionals. Anybody feel happy? So the fourth question is, anybody feel happy? Yes. Okay. Okay. A few more seconds. All right. I'm gonna end this post happy. So I'll share this result as 65% is yes and 35% is no. Okay. This is actually last one. Anybody feel angry? Angry. Okay. The last questions is angry. Thank you. So a few more seconds for people who get cash in their vote. Okay, so 30% say yes, or 31% say yes, and 69% say no. Okay, share that with you. Thank you so much for participating in that. So again, mental health is a spectrum, and when things like this happen to us, we need to sort of understand ourselves, and I'm sure there's a lot of reason for us to be more happy, and it's yes, I'm sad, but a lot of people, almost 50% say no, I'm not sad, or people say 30% no, I'm not angry. This is something that life has just throw at us, and this is how we embrace it. So I wanted to share this mental health continuums models with you. And this is just for your reference, that because we, in a healthy side of mental health, people feel the normal mood, just like how I just asked you, if something happened to us, do we feel angry, we feel happy, we feel sad, we're gonna try to relax, right? So it's a normal fluctuations of mood, and some of us can still keep a good sense of humor, take ways to generate good exercise, good energy, so we can do physical, social aspect of it, and then when we start, our mental health start to react to certain things, is you start feeling very impatient, very nervous, just like some of you share with us that is anxious, sometimes we're angry or overwhelmed, we don't have energy, and we kind of find other means, like if, you know, people would probably go gambling or having to use recreational drugs, or addicted to do something that it could help them at this time to react to a change. And then it moves slowly to injured and ill. So injured is like the more this is happening to me, why is it happening? Why am I so angry about this? You feel your nervous, become very anxious. You don't know what's next. We lose our job. Our children couldn't go to school. They have to do online. I have to take care of my children. So many things starting to unfold, and you have quite a bit of negative attitude towards something that happened to us. And this is just a simple questions about what is happening to us, right? And then when there isn't when we feel ill or starting to have issues, we outburst, angry, our mood, we feel depressed, we feel very upset. We're starting to have physical manifesting that we so tired, we couldn't sleep. So this is the spectrum that, remember earlier I said it's a state, and this is also a state of persons that go through whether from spectrum healthy to ill. Okay, can we go to the next? If you have any questions, please let me know. Okay, so holistic health. I'm sure some of you or most of you already know this, but I just wanted to remind or refresh your memories. At Hong Fu, we values holistic health because we don't look at our clients as one aspect. We look at them as a whole person. So whole person, holistically healthy is mind, body, and spirit as well. So if you look into, this is actually one of my favorite graphs to unfold an individual. So everyone, let's say you are holistically healthy, you're in the middle there, you are balance of mind, body, and spirit. Yet you also live with the family and the community and the society. It's like an onions that different layers. So as a person, you might be having your own communications, your own relationship to yourself, or your own responsibilities. But when you unfold, because not all of us living on our own, we have families, we have responsibilities.
May I move the floor? It will be no noise.
Yeah. So we have a lot of responsibilities. So again, we have to balance the roles, responsibility, relationship, and communications. And then again, community-wise. So can we live on our own? Can we live with only our family? As the pandemic shows that we do need the whole community to be feeling belonging, to feel that we are we embraced by the community, we embraced by the society. So if you move forward to the next slide, it's this is like a concept of the social aspect that determines your health, the influence of your health. Okay, so what it is it's a conditions in a place where you live, you learn, you work, and you play that affect your health and your health risks and your health outcome. So that's what we call it, the social determinants of health, the social aspect that determine that individual health or in our health. Okay, so I hope that's I'm gonna make it more clear with the picture. Can we show the next slide? So this is the social, your physical aspect of the physical environment. So you as a person or family, the person, what is the social aspect that determines someone's health? For instance, if we live in an environment that have poor quality of health, poor water quality, that we cannot even drink out of our tap water, that we have to deal with a lot of traffic. That's, I don't know about you folks, but when we used to go to the office, traffic is #1 stress for me, okay? And sitting in there on the way home to, on the way to work or back home, it's a huge stress, okay? That is the social determinants of my own health. And again, when we have, where do we live? If we live, we have young children, do we have parks so that they can have some physical exercise, or they can have safe space? Or do we live in the environment that, oh, it's after dark, I better get home because I feel unsafe when I need to travel in the dark, right? So a lot of our own, the environment around us determines our health. And a lot of time, we think about everything: housing, transit, even the weather itself. I remember when we first migrated to Canada, the cold is just killing my grandmother and killing my mom so badly. They're like, oh my God, it's so cold. I cannot handle this, right? So everything that you live around us, it affects you. It calls social determinants of health. Okay, so maybe we can show a video that can be a little bit more clear on this.
What is good health? And how do we move toward a healthier future? Many Canadians believe that a good healthcare system is the ticket to health. But good health is more than just doctors, drugs, and hospitals. Healthcare is what we access when we're already sick. Some of today's most prevalent healthcare issues include heart disease, diabetes, childhood obesity, and depression. But what are the causes of these issues? How often do we talk about what happens before the doctor? Let's look at the underlying differences between healthy and unhealthy societies. Starting with the facts. Although immigrants arrive healthier than people born in Canada, their health generally declines over time. People with low income are more likely to report poor health. Neighborhoods where good transit, healthy food, and public services are difficult to access are more likely to have higher diabetes rates. Why is this the case? How do we move toward a healthier future? To find out, we need to step outside of the healthcare system for a moment and take in the big picture. After all, healthcare is what we do when we're already sick. Let's look at the root of the problem, because changes at the roots benefit us all, no matter who we are. We're talking about things like where we work, play, eat, and live. We're talking about the social determinants of health. Access to healthcare is an important social determinant of health. But there are many others that are just as important, some that might surprise you. Working a secure job with benefits, feeling part of a strong and vibrant community, living in a safe, affordable home, living in a neighborhood that is easy to get around in with parks and community spaces, accessing healthy and affordable food, and having opportunities to pursue education. Our health and well-being is shaped by our daily lives and how our economic and social conditions affect us. These conditions don't work in isolation. In fact, they're all connected like a big, complex web. Let's start making the connections. Access to education means gaining skills to find employment. A good job that pays well means you can afford to pay your rent and your bills. Having more affordable housing also frees up money for good and healthy food. Safe, well-connected streets in our neighborhood make it easier to get where we need to go and back home again. When all of this is available, we can better connect with our neighbors and communities. For parents, these also mean helping their kids do better in school. And let's not forget access to healthcare. We've only mentioned 7 determinants here, but there are many others. What about racism, sexism, and culture? What determinants play a role in your health? Because the social determinants of health are so closely connected, one change can trigger many others that affect your health. If every kid had access to healthy food and a safe home, imagine the difference it could make to their education and their health over time. The connections and the possibilities for good health are endless. So from small changes in your neighborhood, like clean, well-lit parks, to big steps in government policy, like a national housing plan, we can start making the connections to a healthier community, a healthier city, a healthier society, a healthier you.
Okay, so I hope that's make it a little bit more clear, and there's more resources on the social determinants of health on our presentation slides as well. And remember, I mean, we are in the society that we lived, and we are the agent of change. Okay, so Maria.
Okay, thank you. I do apologize, like that square thing keep coming up. I don't know how to get rid of them. I try my best, so bear with me. Okay, so from the previous presentation, we can see that when we are talking about individuals' health, our own health, it is not only depend on our own hand. Even I would like to be the most healthy woman, but my environment may also impact greatly on me. For example, the pandemic. None of us want the pandemic, but that happened, and it impacts in each one of us. And when I see the poll, it's very interesting. So although each one of us had gone through, we have to cope with this pandemic, but we have different feeling. So it illustrates that even we are going through the same situation, but we may have different reaction or different coping strategy towards the same situation. So that's why we are going to talk about health equality versus the health equity. Why is that important? Why is it that when we are talking about individuals' health, it is not only individuals' matter? Sometimes, many of time, it's beyond individuals' control. So when we talk about the health equality, that means everyone had the same thing. And I must say that Canada is always trying the best to be equal. Everything has to be equal. No one should be discriminate. We promote fairness. But sometimes when we ask, does that mean it's fair? Everyone can get the same services? Well, maybe theoretically speaking, everyone can access the health practitioner, or they can use whatever services. But is that true? Say if I don't speak the languages and I need the emergency services, but if I go to the hospital and they do not provide any interpreter, so I still cannot communicate. So things like that. Or I have to work a long hour every day. And although there is language training available in the community agency, like each one of us provide, but I have to work long hour. Although there is language training, but I'm not able to access it because I have to work from 9 till 9 in the evening. I only got Saturday off. So is there any class going to be available on Saturday? So when we are talking about equity, it is different than equality. Because our goal here is not only to create the language class. We want to have a language class that meeting the needs of people who need that class. So that is our goal. So when we are talking about equity, so we believe that everyone should have the right to enjoy the optimal health. We are all equal, and that is the basic human right. So when we look at this picture, it can illustrate a little bit more clearly. I'm sure this is a very famous picture. Maybe many of us have saw that before. When we look at the left one, the one on the right hand side, you can see that the different people have different height, And the tall one can see without any need of assistance. And the second one can barely see it. And the third one cannot see. And then if we in here, I mean the first one, like because the two of them cannot see, so we give them equally. Each one have that box. So does that help with the one who is the shortest? It doesn't help because he still cannot see. And for the tall one, he may not even need that box. So the second picture you can see. So that box was given to the shortest one. So everyone now can see. So our goal is for everyone to enjoy the game. But of course, when you see the one on the far right, that means all the barriers are being removed. So we don't need box at all. But there is another picture I really, really like as well. So this one, because when we look at this picture, we can see that biologically, someone may be born shorter and someone is taller in nature. So it seems like, okay, maybe it is their own genetic, but not only that, the environment also help, also contribute to that condition. For example, when you look at this picture, you can see, because like if someone born in a place that maybe have a wealthy family, or maybe in a wealthy country, and they are able to access more resources. So their starting point is already higher than the others. So even they are the equal height, everything's equal, but still someone is able to enjoy the cherry or the apple more. So you can see that the environment has a lot to do with how one can enjoy the equity or the equality. And we are going to go deep into that later on. So right now, we are going to look at how the holistic health and migration, they link together. Because many of us, maybe we are immigrant ourselves. We have gone through that experience. And also, if not, but a lot of the newcomer that we are serving, they are from a new country, a new place. So how the migrations process and settling in a new country will impact on our health. So Emilie is going to share with you.
Thank you. And before we even talk about migrations, we wanted to understand why is migrations? Why do we need to migrate to places? Next slide. Okay, I wanted to give you some stats here, and don't worry, we'll share this PowerPoint with all of you folks so you can fully participate and look at the number. So why migrations matters? Because as many of you know, there's three main reasons actually. Since 2017, it's a quite ambitious plan that they wanted to grow our populations annually by migrations up to 340,000 immigrants by 2020. Again, this three main reason is due to aging populations, and because our populations have not able to keep up the declines of birth rates, and people are retiring, and people are we just need a new workforce, as well as the third one is just purely economics reasons. And if you can see that it's in 2017, 56% is permanent residents that got admitted to economics class. So as you can see that we are replenish our populations by migrations, okay? And again, in 2017, it's 80% of international migrations population growth. And again, if you look at this number, we are very ambitiously wanted to grow our migrations, grow our populations up to 93% of immigrants are, we want, as you can see, is the population's growing. Of course, we wanted our new Canadians or new residents feel like they belong to Canada. And I think it's increased by over 130% from October 1917 to June 18th. I don't have, we actually don't have the stats to see up to how many immigrants by the 2020, because due to pandemics as well. Okay, so next slide. And in fact, it's, and of course, some of you, I know some of you might be serving as refugees as well. And we also have, in 2018, September 2018, we have approximately 26,000 Syrian refugees that is arrive in Canada, and this is where they actually resigns. In Toronto and Ontario, so especially it's Toronto, is 31%, and Ottawa is 2.3%. And this is Ontario's take the most Syrian refugees within our province, and then Quebec, Alberta, and of course BC. And this is where they actually resigned. Next. Oh, the other way. to the map. Okay, so just to have a clear picture of where people migrate or settling in Canada. This is again, most of us are in Ontario. It's 41%. Okay, so this is what we wanted to see. What are the stressors? Just wanted to see a poll again to see how many people actually in this country migrated to this Ontario. How many people are migrate to this to this province or here as immigrants? Wow. Well, thank you. 2 more seconds. Thank you so much. Okay, a few more seconds. I want to share this because this is actually reflects exactly what we have just talked about, is that 75% of you folks are coming from another country, and 25% said no. I would probably assuming that it's you're Canadian born, or you're born some other province and then moved to Ontario. So you can see that many of you might be related to or heard of the stressors that associate for migrations due to migrations process. So can you think of some stressors that you yourself or your family, a member, is actually experience it? So a lot of time, like Maria said earlier, that, you know, maybe we were born somewhere else and then moved here for reasons, whether or not it's a by choice that you migrate to Canada. Of course, if you even do by choice, pre-migration stress is actually huge, right? And so I remember that a lot of our clients share that, you know, before migrated to this wonderful, beautiful, and very well off countries, we have a lot of stress because we have to put our affairs together, we have to sell our house, we have to put our money together, we have to put our children together. And then a lot of time, stress as well is the reason for migrates. Migrations can be by choice, or a lot of our clients are from refugees. As Hong Phuc, we serve refugees from Vietnam, from Cambodia, where they actually flee their countries for because of many reasons, life and death reason, right? And then the process, if whether by choice or you have to go, the process of migrations is actually also a huge stressors too, because a lot of countries where they view officers or police men and women are authority figures, and sometimes they're afraid of it. So the process is, for the persons who migrate, is also a huge stressors. And then when we get to the host country, the first experience of the process is actually whether it's a good experience or a bad experience, it's carry alongside with you for a long time. If you have a good experience where the host country welcoming you, I remember a lot of our clients were saying that, I moved to Windsor in the winter, and a lot of people come, our sponsor came and get us from the airport, and they brought jacket, they brought many things to keep us warm, to make sure that we get what we need, and that memories is carry alongside with them almost all their journey. And some share that the host country I was so scared. They asked so many questions, and I actually didn't know what they were talking about. And we waited for a long time, and because, so many the process, and I didn't understand. So migrations can be a huge stressors, whether or not you're ready for this migrations or not. We have actually it's a case study I wanted to share with you, and then at this time, let's go through this case study first, and then we can split you into a different group so we can talk. You can talk about it. Okay, so this case studies is about Elle. She is about 40 years old. She's a 40 years old refugee from Jordan, and she admits as a government sponsors.
That makes sense.
So she comes with her husband and her daughter. So her husband they're both teachers back home, but when they come to Canada, only Elle can find a job, and she was working at the grocery store, and the husband's actually is quite frustrated with this experience and very disappointed because he couldn't find a job, and the roles was reversed. So he complained about it. But the daughters actually didn't do well in school, but he didn't even care about that. He starts abusing verbally, emotionally, and physical, and so he gets quite upset about things, very short. And then Elle actually very afraid of the situations. She live under fear, and she's feel highly anxiety about the situations. And in the meanwhile, the daughter is not doing well. So the teachers were informing them that she's withdraw. One day, the husband come home and threatened to beat her up and the daughter. And so she was very afraid. So she called 911. So she actually didn't want it to leave her husband, but she just wanted to help deal with this difficulty, because she remember when she went to orientations at your organizations, and she remembers that if there's some situations, you can call 911 for help. Okay, so this is the case study. And then if you can focus on these questions, we have about 10 minutes. We're gonna split you into different rooms, and we will talk about the experience, migration experience of each and every one, like the daughter and the Al and her husband, right? And identical some stressors that these three individuals might experience. And then just see if you can see some sort of coping skills or something like that, something that both Elle and her husband is actually, and the daughter actually have. If yes, what are they? And then if you can see what strength is these families have. Actually at Hong Fook, we focus on a lot of strength on an individual's, on strength of the whole situation, so that we can identify and that we can help this family. Okay, so Dina, if you can kindly split people into different in different room, and we get about 8 to 9 people in one room, and then we'll meet back here in 10 minutes.
Wonderful, I'll do that now.
Hello.
Hello.
Hello, we'll just wait a second as everyone comes back in and then we'll get back into the presentation.
Thank you so much. Now we are back. Okay, so let me share the screen. Can everyone see the screen of the PowerPoint?
No.
Okay, so
No.
all right, I will do that again. Now it's okay?
Yes, thank you.
Yes.
Yeah, I also participate in one of the group discussion, and it's very interesting. So I know that because we have a large group, I do ask for everyone's forgiveness, because in order to debrief, that will take a longer time. But I think that is a very good exercise for us to go through, or maybe those are the case that we encounter on a daily basis, on our practice on a daily basis. So I just want to stress that if we focus on the strength, because I truly believe no matter what situation we are at, even the pandemic, right, that never happened since we were born, actually. And even in this very horrible or difficult situation, if we can find some strength, then we will be able to see what we can do, what positive change we can do. But if we only look at the negative part, then we will see this door is closed and that door is closed as well. So again, I would stress that everyone, please, if you have any question, you can type, and also we will allow some time for everyone to ask questions. And right now, I would like to show a video, which is, for me, for us, I found that to be very touching. It is demonstrating how the second generation, they may be born in Canada, but their parents are from overseas. So how they, as the second generation, what they have gone through and what they want to say.
And that's, oh God, I didn't think I was gonna cry. Both of them left their families and knew no one and came to this foreign country. Now, my mom moved to America and didn't get to see her family or her siblings for almost 20, 30 years. Didn't get to see her mom's funeral, didn't get to see her siblings grow up with their families because she was living in America. My mom used to come to my elementary school every year with traditional dress and a Quran and a prayer rug to like teach the kids about Eid. 1 year after she came, a lot of kids made fun of sort of the way she dressed and what she was doing and what she was talking about. And I was really angry at her. And I told her like never to come back again because I was really, really embarrassed. And she listened, but I think she was really hurt. I remember when I went to India in 2008 with my mom for a wedding, she said that was the first time she had ever visited the Taj Mahal, even though she grew up in India. And the reason was that she just spent her life working for us. My dad, before he died, he was looking for all these jobs of things that he didn't love to do. And he loved playing music, but he knew that he had to make a little more money. They took odd jobs. My dad worked at a restaurant. He cut grass. I remember stories that they used to look for aluminum cans to recycle from the neighborhood. When I was in kindergarten, I remember that my mom, she sat me down and asked me, would you like it if I stayed home more so I could hang out with you? And I said yes. And so she gave up her career as a computer engineer to become a full-time mom.
My mom was encouraged to be a stay-at-home mom in her older years. She felt really isolated because it contributed to her not being able to learn English and make friends outside of the family circle.
I used to cry every time that my mom would drop me off. There's like a video of me at daycare, and I was like 3 years old, and I ran after her, and they had to go get me. And my mom would cry too because she didn't want to leave me, but she had to work.
Even to this day, my parents are still struggling, like, financially. When I got into college, I got into UCLA and USC, UCLA being a public school, which was a lot cheaper than USC private school. And my dad just said, go wherever you want and we'll figure it out. My parents had to take out a lot of loans and stuff. I didn't get any scholarships or anything. We're still paying those off right now. Yeah. Oh man, okay.
Hi, Mom and Dad.
Mom, Dad.
Mom, thank you for all the little things that you did that I didn't know about.
Especially as a single mom, raising us all by herself. And even to this day, working 6 days a week still. I know I don't always say it, but I really appreciate everything you've done for me.
I'm sorry for the way I acted as a kid because I'm not ashamed of you. I'm really proud of you. And I'm really proud of who you are. And I'm really sorry that I used to pretend that I was white. I'm really sorry that I used to pretend that I wasn't Muslim. And
Thank you for everything. You did more than I ever deserved. Sorry. I love you.
Thanks, Mom.
Yeah, thank you. Yeah, thank you.
All right, let's come back. And for us, I and Emilie, we really enjoyed that video clip. It is very touching. As the first generation of immigrant, like we can deeply feel that even if our children are born here, but you know, the root is always there. And also I would like to share with you some statistics. So when we are talking today about health equality and equity, why is it important? Because we all know Canada is made of immigrants. Many of us, the population, like people from all over the world come here. But when we are looking at the statistic, we are able to see there is a big gap when we are talking about access to services and the health status. So this is the most recent study done by the Association of Canadian Study. So it's especially during the pandemic time. So what they are, as we all can appreciate, many of us, maybe including myself, we are worried about our financial obligation. Maybe I got laid off, or maybe that is cut down of my hour. So my worry is of the financial obligation, but how much is that had impact on our mental health? Let's look at this statistic. For the Canadian born, even I'm a visible minority. That is meaning the first column, as you can see in the white, the column, it is the visible minority. As a visible minority, that worry impact on my mental health, 28%. But for the non-visible minority, maybe white, for the people not having the colored skin, they are 21%. And when we come to the second category, our capacity to pay for our mortgage or rent, and the gap is minus, like that, you can see the gap there. And look at the last one, your capacity to assist other family members financially is mine also, that is a gap. And each category has a gap. Even we are talking about, we both are born in Canada. But then when we look at the middle one, the established immigrant, say we are here, we are immigrant, I'm immigrant from Hong Kong. I'm here for over 30 years now. So I'm a long established immigrant, but I'm a visible minority of women. And you can still see, compare with the visible minority group and the non-visible minority group, even we both migrate from other countries, and there is a gap in terms of our worry, in terms of that, how it impacts on our mental health. So you can see the gap is getting bigger. And when we look at the far right, the recent immigrant, like the newcomer that many of us are serving right now, the gap is even bigger. So you can see from this statistic, this is a very recent statistic that has such compete. You can see that how the health equity really impact on individuals. So that means even each one of us want to maintain our health status to be most as healthy as we can, but the environment and the way that whether we can access the services, whether we can have the opportunity to advance in the employment, or even have the opportunity under the fair competition to get a job. All these impact on us because of our status. So that's why it is very important for us as a worker to be aware of that. And also maybe we can do something about that. So when we look at the social determinant of health that we talked about earlier, that for the immigrant, for the newcomer, we can, on top of all those social determinants that impact on each individual, no matter they are immigrant or non-immigrant, but for immigrant, they even facing extra barrier. For example, the family support or the social support. I am from Hong Kong. I already established a very strong support from my family and also from the community that I'm involved in. But to come to Canada, I like this beautiful country, and yet I have to start building my network again. So the loss of that, I have to start from the scratch to build it. And unemployment. I still remember when I first come to Canada, although I got admitted because of my specialty, everywhere I go, for the first 1 year, they will say, well, you know, we need the Canadian experience. But I am very appreciate that because right now, at least they cannot ask that question. They cannot use that reasoning. But I mean, you know, but still they can use different way. Just saying that, oh, we will let you know, and they will say, oh, we find the best candidate. I'm so sorry, right? Something like that. So the unemployment or the underemployment that are happening among the immigrant group, I'm sure that that is a common factor we all know. And also the language barrier, of course, and the change in the socio-economic status. Back home, I enjoy, I can easily enjoy some luxury, but maybe right now, after I came here, the cut in my income and also starting a new family, maybe I will need more money. So I have to tighten my expense. So all these meaning the changes that really place a lot of stress on the immigrant family. And the experience of trauma, if I have trauma before or after or during the migration process, and the loss of value and the gift of loss of family and friend, the anxiety over family and friends that left behind. I'm talking about maybe our refugee client. And also from the fact and research, we also show that there is an underutilization of mental health system among the immigrant and refugees. So from the statistic before, we will think, okay, the immigrant and the refugee population, they have undergone more stress than the native born. And yet it should show, if it is following the logic, they should be the group that will visit our health practitioner more frequently. But when we are looking at the statistic, it is the opposite. They are less likely to seek help. And even they do, there is a delay. That means, you know, maybe it's already the illness evolved into a later phase. And also because there is inequitable access to culturally appropriate mental health services. I still remember many clients, before I joined Hong Kong, many of my clients, they said that they have to have a half-year waiting list before they can see someone who speaks the same language from the same culture. So all this plays an extra barrier for our client. And of course, like the economic, employment opportunity, housing. I mean, all these for new immigrants, they have to navigate, and that also place extra stress on them. So we would like to also, like we cannot just jump to something right away. The action to take at each phase of continuum. Earlier, we talked about mental health as a continuum, because like I am not totally healthy, does not mean that I am ill. Maybe I'm reacting to the situation, the pandemic, and also I am in the transition period from one job to another job. So, I mean, that period also places a lot of stress on me. So navigating that and trying to get back to the optimal health. So each stage, what action or what focus should we focus on to help us or to help our client to navigate? Like, after all, we can only deal with the problem on hand. I'm sure that we all heard about the mindfulness, which is, we have to focus on that, and then that will be much easier for us, and also to help us to focus. And also, I still remember when we first started this journey of to promote mental health and this training, many times we were told by our colleague, our frontline colleague, that we just fill out the form and we tell them where to go if they need services. But I really feel that we can go beyond that to advocate. As we know that, the immigrant group or the refugee group, the client that we are helping on a daily basis, that they are facing tremendous barrier. So on top of helping them to navigate the system, we can also maybe to promote from our agency, how to promote a safe environment for them to share, or whatever services that we can see that is needed and to meet that need. For example, I give you the example that if we observe in this area, lots of new immigrants speak Chinese who reside in this place, and they need the language barrier. I mean, they have the language barrier and they need the link class. So we set up the link class, but nobody comes. Why is it? And then we have to dig deep into it, because we would like the people who really in need of the services to come and utilize the services. So if we go one step further to find out what's the reason, maybe because they have to work so many hours, or maybe they have small baby at home, so they need the babysitter, or they maybe we have to establish the class, or we organize the class on the weekend to meet certain group of people's needs. So things like that. So all these we can help to accommodate the needs of the population. We go a step further. And on top of that, we can also advocate on our group behalf, on the people that we serve on their behalf, maybe for the agency. I remember before I come to Hong Kong, the agency that I work at, we are not allowed to take clients, to escort clients. And at that time, not many agencies, they provide interpreter services. So even if I link them up with the appointment to the government agency, but they cannot communicate, and that agency, they don't have interpreter. So we will advocate to our agency saying that, can we maybe establish some training for to recruit volunteer to do that. I know that because of our funding, we cannot escort our client. Maybe IRCC does not allow us to escort client, but we can train our community people to be the interpreter to do that. So things like that, we can be creative. So that concludes our presentation. And also, this is also about the cultural sensitive services for newcomer, that we are going to address also. How are we going to do that in our third webinar as well? Right now, I really would like to invite the audience or the forum, if you have any feedback or question, please, you just unmute yourself and you can maybe raise your hand and speak. All right? So if you have any question at all. Today, I also want to stress that we did not talk about mental illness because that will be our next week's topic. So we will also invite someone who has the life experience. He is going to come and share his recovery journey and what will help him in the journey, in his journey, so that we can learn from him. So if you have any question, please unmute yourself and you can talk. Is there any question or any feedback? I saw that there's the chat box. Emilie, can you see any question there?
No, not yet.
Oh.
Well, we will send out a survey. You are more than welcome to fill it out and let us know how we can improve our presentations and make it more lively. I know I know myself and Maria is working very hard to adapt to non-person training, because again, I don't know about you folks, but I live under the rock. I don't know a lot of technology, but with the help of a tech person, we will do better next time. We have a few hiccups today, but it's I wish we will have in-person training soon and get to see you folks. Thank you so much. I haven't seen any questions so far, Maria. Yeah, so we purposely leave about 5 to 10 minutes so we can hear from you folks, but I guess online a lot of people are a little bit shy. Yeah. Awesome.
Okay, so I mean, never mind, but we really appreciate that for your joining the webinar today, and really we appreciate your time and your attention. We will try our best, so hopefully we can keep on improving. And thanks so much again to join our journey, and see you next week, hopefully. Thank you so much.
Thank you so much. See you soon.